Hello everyone. In this session, let us learn about the medical applications of signal analysis. In the last video, we learned about the basics of biosignals and the analysis technique of ECG. In this video, let us learn about signal analysis of EEG. To start with, what is EEG? EEG stands for electroencephalography. As I said earlier, graphy means study, encephalon means brain. This electro means electrical activity. So graphy is study, encephalon means brain, electro stands for electrical activity or electricity. So EEG is study of electrical activity of brain. So study of electrical activity of brain is called as encephalography, electroencephalography. We use an instrument which is called as electroencephalograph. Electroencephalograph. If graph is there, it is the instrument. Graph means instrument. The instrument which is used to record or study the electrical activity of brain is called electroencephalograph. Graph. What is then gram? Gram means waveform output. The waveform which depicts the electrical activity of brain is electroencephalogram. Electroencephalogram means it's a waveform that depicts the electrical activity of brain. So how this EEG is performed? EEG is performed like a technique which is very similar to ECG, where we fix electrodes on the scalp. Scalp is the outer layer of the skull. So we fix electrodes on the outer layer of the skull, which is the scalp, by using surface electrodes. We place about 24 electrodes on the surface of the surface of the scalp by a technique which is called as 10-20 electrode placement system. There is a procedure how to position or place electrodes on the scalp to record the electrical activity of a brain, which is called as 10-20 electrode placement system. We position the electrodes on the scalp using that protocol, and we use reference electrodes which are connected in the earlobes, and we record the potentials across two adjacent electrodes or two electrodes on the scalp, which will give you which will be connected to a differential amplifier, which will give you the voltage that is the differential voltage between two adjacent electrodes. These electrodes will measure the electrical potentials beneath the cells or that are in that region of the brain. So likewise, we place electrodes across the entire scalp to record the electrical potentials around the entire scalp. What are these? We know that neurons are the brain cells. Neurons are the building blocks of brain. The brain cells are otherwise called as neurons. These brain cells communicate among themselves by means of tiny electrical impulses. Why EEG? What is the purpose of EEG? So EEG, we said it is an it is a diagnostic test which is used to record the electrical activity of brain. What is the main purpose of EEG? Is that EEG is a diagnostic test which is performed to assess, evaluate, diagnose various brain disorders. For example, when a brain is not functioning normally, there is a possibility for occurrence of seizure. Seizure is a sudden burst of a sudden burst of nerve impulses or an uncontrolled electrical activity between the brain cells. We learned that brain cells communicate together with each other by means of electrical impulses. When there is a sudden burst of electrical impulses between the brain cells, that's a sudden burst of electrical impulses. We call that condition as a seizure. Seizure is an indication of abnormal functioning of brain cells, which indicates a diseased condition or a pathological condition. When there is epilepsy, for example, let us take epilepsy. When epilepsy is present, or when epilepsy condition occurs, seizure activity definitely occur in resulting in abnormal spikes in EEG waves. In short, When brain is normal, the brain cells communicate with with communicate with each other by normal electrical wave. There will be normal communication between the brain cells. The electrical cells will be definite. Whenever there is an abnormality in the brain, there is possibility of occurrence of seizure, which will lead to an uncontrolled electrical activity between the brain cells. Similarly, with people with who are suffering from tumor or stroke, there is a possibility that they will have an waveform, EEG waveform, which will definitely differ from an normal EEG. The waveform EEG waves will differ from a normal EEG. These waves are called difference in waves are called as slow EEG waves, and this depends upon the size, location of the tumor or lesion in the brain. In short, whenever there is an abnormality in the brain, the EEG waves will not be normal. By looking into this EEG wave, we can assess the diseased nature of that particular subject. There will be an seizure. There is possibility of occurrence of seizure, which is a sudden burst of electrical activity in the brain. As I said that an EEG for a deceased person will always differ with a normal person. EEG for normal and abnormal person will significantly vary. What is that significant variations? An EEG is characterized by frequency and amplitude and, and waveform pattern which are obtained at different locations, which can be obtained from different locations of the brain. For example, if you take a human brain, the human brain is divided into four lobes: frontal, temporal, parietal, and occipital. And electrodes will be fixed at across all these lobes. The waveform obtained at different lobes of the brain will exhibit a definite pattern. When there are variation in these pattern of the waves obtained from the different lobes, they indicate an abnormal condition. As we know that EEG waves are characterized by frequency and amplitude, and the waveform pattern from which location or from which lobe of the brain they are obtained. So a normal EEG will have a waveform with certain values of frequency, with certain values of amplitude, and with certain pattern of wave. This will definitely differ for an EEG. This EEG will definitely differ for an abnormal subject, abnormal condition. So, in short, by looking into the frequency of a normal EEG and frequency of an abnormal EEG will be different. Amplitude will be different for both normal and abnormal, and the wave pattern or the wave shape also will be different for a normal and an abnormal EEG. So what are the features of a normal EEG? So any character whenever there is these are the listed features are the characteristics of a normal EEG. Any deviation in these features of for the concerned subject, if there is any deviation in the recorded EEG of the concerned subject, if it differs with these specifications, it denotes that the concerned subject or the concerned individual is suffering from some abnormality. So, what are the features of a normal EEG? Most waves in adult EEG, adult awake EEG, will be at least 8 Hz. The frequency of an EEG will be for a normal adult will be 8 Hz, at least 8 Hz. And similarly, beta waves are those waves with frequency ranging from 13 to 30 hertz. This is the common rhythm. This is the common rhythm that is seen in normal adults and children. Alpha waves. Alpha waves are those signals which are obtained from the electrodes that are placed in the occipital lobe of a brain. For a normal subject who is awake, the frequency of this alpha wave will range from 8 to 12 hertz. Similarly, theta wave and delta wave are associated with sleep and drowsiness. A rhythm that is associated with drowsiness and early stages of sleep is a theta wave, which will lie in the range 4 to 7 hertz. Delta waves are the rhythm which are associated with deep sleep, and the frequency may range from 0.5 to 4 hertz. If you see here, this 4 to the lower frequency from from almost zero point 0.5 to 7 hertz, it is the person is in the state of drowsiness or sleep, and alpha and beta are in the state are in active state. So the waveform ranges from 8 to almost 30. Beta waves is for the general normal rhythm for a normal adult children. The range beta waves will range from 13 to 30, and this will be from 8 to 12. The thing is that this will be obtained from the occipital lobe. And moreover, these are the frequency characteristics of a normal ECG. And what is the amplitude characteristics of a normal ECG? ECG wave will have an amplitude which will be around 25 microvolt. Any wave recorded from the scalp or any EEG wave record which is having voltage or amplitude greater than 25 microvolt, it indicates abnormality. EEG wave, if the waveform, if the recorded waveform shows amplitude which is greater than 25 microvolt, it is an abnormality. For example, epileptic cases will exhibit EEG waveform, and epileptic subject will have amplitude which will be greater than 25 microvolt in the order of 50 microvolt or 100 microvolt. So what is this EEG signal analysis? As discussed earlier, we were talking about ECG signal analysis. Why do we do signal analysis? The neurologist or the doctor makes observes this clinical results of the clinical test and makes his interpretation. He plans his treatment looking into the results that are being given by the machine. For example, if the electroencephalographs gives you an electroencephalogram, he observes those waveform, or he observes the EEG waves, and he makes his decision and he plans his treatment accordingly. In order to avoid misdiagnosis by looking into the, in order to avoid misdiagnosis and to avoid improper treatment planning, what is essential is that we need to present the EEG waveform to the doctor or to the neurologist, which is in its pure form, which is free from errors, or which is flawless. So EEG signal analysis is very much important. The purpose of doing EEG analysis, signal analysis like EEG, is that to present the wave to the clinician in the most accurate manner available, in order to avoid misdiagnosis and to ensure that the treatment is planned properly. What are the basic steps in EEG analysis? EEG analysis and ECG analysis are very similar, except the frequency range of the signal. Though both the signals lie in the low frequency range. The thing is that EEG, ECG are very similar. These are EEGs obtained from the scalp. These are obtained from the surface of the body, either at the chest or at the lips. The characteristics of both the signals are very similar, but the amplitude characteristics might slightly differ because EEG is recorded from the scalp, so there is always a reduction in an amplitude. EEG, the amplitude will be in the order of microvolt. For ECG, it will be in the order of millivolt. The amplitude of ECG signal will be relatively higher, whereas the amplitude of EEG will be relatively lower. This will be ECG will be in millivolt, and this will be in microvolt. The reason for this is that the brain cells electrical activity is measured at the scalp, as the electrical potentials are captured on the superficial layer, and there is a possibility of huge or large amount of attenuation, which makes this amplitude to 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 be very lower. So what are the basic steps in EEG signal analysis? As ECG signal analysis, we get the raw data, we process the data, we extract the features, and we classify them as normal and abnormal based on the selected features. So this is the procedure is very similar. You get the raw data, raw EEG data, which is not free from noise, which will have which will be influenced by noise. In pre-processing, we denoise it, we remove the unwanted signal, we get the pure form of signal. From the pure form of signal, we apply signal processing tools to extract features which are of clinical importance, and those clinically relevant and important features are given to a system, and the system is trained to classify them as normal and abnormal. So pre-processing, what is pre-processing? We know the characteristics of an ECG, EEG wave. So we know that we have learned that what are the characteristics of an EEG wave. EEG wave, a normal EEG wave will not have a frequency less than 8 Hz. Likewise, we know what is the, it is very essential to know the characteristics of an EEG wave. So once you know the characteristic of an EEG wave, we need to know what is the specified range of an or specified frequency range of an EEG signal. So accordingly, we have to eliminate those ranges which does not apply to a normal EEG. So that is what is to be done. We need to remove the unwanted signals in the raw EEG obtained to get a pure waveform. So we need to remove components which are of lower frequency, which does not apply to EEG. Similarly, we need to remove higher frequency components which does not apply to EEG. So there is a need for high pass and low pass filter to remove unnecessary frequency which does not which does not contribute to the cause of EEG. Here we use an high pass filter which is cutoff frequency 1 Hertz to remove the DC components of the signal which are close to 0 Hertz. A high frequency filter with cutoff frequency 1 Hertz will remove DC components of the signal or signals which are with frequency close to 0 Hertz. And we know that high frequency components are always noises. So we need to use a low frequency filter to remove this high frequency components. And one more important thing is that EOG artifact correction. We know that EOG stands for electroaculogram. So it is the electrical activity produced from the eyeball, movement of eyeball. So when a person who is undergoing a EEG test, when he blinks his eye, the eye blink may cause an electrical potential which may interfere with the EEG signal, which will disturb which is not good for EEG recording. So what has to be done is that the electrical impulse, the electrical signals which have been caused due to eye blink, that is the EOG signals that corresponds to the electrical potential of eye, has to be eliminated. We have to use appropriate filters to remove those signals. What is then we'll move on to feature extraction. So we need to extract fiducial points, we need to extract landmark points of an EEG signal to make prompt diagnosis and to enable classification of EEG, whether it is a normal or an abnormal. We need to train a computer. For example, as we are moving towards automated system, computer based system, we feed the system with an EEG, and the system is supposed to respond it whether it is whether the EEG given or whether the EEG fed into it is a normal or an abnormal EEG. How to do it? So we need to first thing is that we need to remove all the noise. We need to denoise it. Once it is denoised, we need to once the waveform is in its pure form, we need to extract the important features which are clinically relevant in EEG. So what is to be done? So there are different ways of doing it because it is very difficult to extract all information using naked eye. So we rely on systems, we rely on computer-based systems to extract those hidden information from an EEG signal. So as discussed earlier, frequency and amplitude of these EEG waves are very important for interpretation of EEG. So it is very essential to extract this frequency and amplitude features in an EEG signal for interpreting the results of an EEG. There are different ways of extracting these features. But let us discuss one by one. The first one is frequency analysis. So what in frequency analysis we do is that we take the raw EEG, we denoise it, we apply Fourier transform. Fourier transform is a technique which is used to convert a time domain signal into a frequency domain signal. The frequency domain signal, the signal is expressed in multiples of sinusoids. It is expressed in form of sinusoids. So this sinusoids is the signal is expressed in terms of frequency, and the amplitude is the amplitude will be expressed in y-axis, and x-axis will be frequency. This is called as a spectrum. The signal with is represented as a function of frequency. At every frequency, at every for every values of frequency, we can know what is the amplitude of the signal. So the signal is represented as a function of frequency, and this method is very easy to extract and interpret the various underlying conditions in an ECG, in a EEG, in a very simple and effective manner. Next is amplitude analysis. As we discussed earlier, that any amplitude of an EEG, if it is greater than 25 microvolt, it indicates an clinically abnormal condition. So changes in EEG wave amplitudes are vital. They indicate a pathological condition. They indicate a diseased condition. So how it is expressed? In what we do is that we know that power is power of any signal can be obtained by V square by R. That is, power is a function of square of amplitude. We plot the power density spectrum where power is on y-axis and frequency is on x-axis. We can define the value. We can clearly, the power spectrum will define the values of power at every set of frequencies. The power will be in the order of nanowatt or picowatt because the amplitude is in the term is in the order of microvolt. So by looking into the by looking into the power density spectrum, it is very easy to figure out what is the value of power of this, what is the value of power of the EEG at different values of frequency. So next is, once all the features are extracted, we have to select those important features which are of clinical importance in diagnosing the pathological conditions from an EEG. It has to be given to a system which is to be trained to classify it as normal or abnormal EEG. So what are the characteristics of abnormal EEG? Frequency, as we discussed earlier, it is any waveform which is having frequency less than 8 Hz, that is 7 Hz or less, is an abnormal condition. As any waveform which is having frequency greater than 8 Hz are regarded as normal. Similarly, amplitude 25 microvolt is the threshold amplitude. Any amplitude greater than 25 microvolt indicates that it is under diseased condition. For example, let us see here the in epilepsy, the epilepsy is a case where the amplitude is more than 50 100 microvolt. So these are the abnormal states of EEG. So what is classification? The system can be trained by imparting adequate knowledge on normal and abnormal EEG. Once the adequate data is deployed to train the system on normal and abnormal patterns, any reliable pattern classification algorithm can be used to classify EEG wave as either normal or abnormal. Okay, with this we'll move on to electromyography. What is electromyography? Electro is electrical activity. Myo means muscle. Graphy means study. Study about the electrical activity of muscles is called as electromyography. What is this electromyography? Similarly, electromyograph means the instrument which is used to study the electrical activity of muscles. Electromyogram is the graphical waveform which we see on this monitor, which we see on this monitor is myogram. This is set up as the instrument graph, and graphy is the study. So what is electromyography? Electromyography is a diagnostic test which is used to study the electrical activity of skeletal muscles. So whenever we make any body movement, lifting a hand, folding our leg, or folding our arms, what happens is that there is a complex communication which is involved between the central nervous system and the motor nerves. So whenever this complex communication between the sensory nerves, motor nerves, and the central nervous system is not properly established, there is an issue. There is a pathological condition. The functioning of the motor units or sensory unit may not happen properly. So it is very essential to know whether there is a problem between the muscle or the nerve. So henceforth, we require a diagnostic test to detect issues between these motor nerves, muscles, or communication between these two. Whenever there is an impairment, whenever there is a difficulty in 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 bodily motions, EMG is preferred to identify the underlying cause of that case, whether it is a nerval issue, whether it is a nerve issue or a muscular issue, muscular damage. So generally, EMG test is performed with in conjunction with another test, what is called as nerve conduction study, or which is also called as nerve conduction velocity (NCV) test. So what is this? What is this nerve conduction study? So what they do is that, for example, how this test is performed, they fix electrode on the surface of the body, and what happens? They fix electrode on the surface of the body. They record these electrodes are a form of needle electrodes, which will be pierced or which will be inserted. There will be a needle which will be inserted into the skin, and which will be a bit painful procedure, and the subject will be has to fold and open his arm or whatever it is, wherever it is applied, they'll ask him to relax and contract the portion of muscles there, and a waveform will be obtained. That is what is EMG. So by fixing electrodes, they'll pierce the electrodes used here will be needle electrode, and these needle electrode, what they do is they will record the electrical potential by piercing a needle electrode, and they'll ask the subject to fold and open his arm or whatever it is, and that is to contract and relax the muscle, and they'll record an activity. This is EMG test. Similarly, what is this nerve conduction test? How, what is the velocity of the electrical impulses through the nerve? That is what is called as NCS or NCV test, nerve conduction velocity, or NCS, nerve conduction study, to know how effective the nerves are carrying the electrical impulses. What they happen is that they give an electrical stimuli, and they take, they measure the time, how much time is required to sense the electrical impulse at a different point, at a measuring site. So this, by this, then you can calculate the velocity. So for example, you give a nerve impulse here, you give a nerve impulse at this point, and you measure the nerve impulse at this point, and what happens is that you know how much is the distance and how much time it takes for you to feel the nerve electrical impulse at this point, and by this you can conduct the, by this you can measure the nerve conduction velocity, which is a, which will tell you whether the nerve is properly carrying the nerve impulses. So both the tests, generally EMG test and NCV or NCS test, are both are performed together. The problem is that why both are performed together is that there is always a requirement to know whether the problem is with the nerve or the muscle. EMG test helps you to know whether your muscles are responding in the right way, muscles are functioning in the right way, and nerve conduction test helps you know whether there is problem with the nerve. So we need to know, because in whenever there is motor functions involved, there is function of muscles, there is function of nerves, and in conjunction, in coordination with the central nervous system. So nerve carries electrical impulses to do a task. Accordingly, the muscles relaxes or contracts. So there is both muscular movement, nerve action, as well as the electrical impulses are carried by these nerves. So it is very essential to know where the problem lies, whether it is with the nerve or whether it is with the muscle. So in order to know the exact root cause of the problem, we conduct both the tests. One is EMG to know where the problem is, whether it is with the muscle. If it is with the nerve, we conduct NCV test or NCS test, nerve conduction study test. Okay. So how this signal analysis is performed? It is very similar how to the one that we have been discussing in the previous cases like EECG, EMG. The steps are the same. You get a raw EMG which will be with the noises, and the next challenge is to remove all those noises, what we call as processing. We remove the noise, we get a pure form of EMG, and we look for important landmark points or crucial points which are of clinical importance in the EMG, and by giving those features to our system, we train it to identify which set of values can contribute to normal, which set of values contribute to abnormal. The system is trained with both normal and abnormal data. Based on that, the system, the computer-based system, will give you an output whether the EMG is a normal EMG or an EMG of a deceased individual. So pre-processing, the raw EMG filters, as we know that before having a priori knowledge, prior knowledge EMG is required. We need to know what is an EMG, what is the frequency of a normal EMG, what is the amplitude of a normal EMG. You need to know what is EMG, what are the characteristics of a normal EMG, what is the frequency, what is its amplitude. All these details is to be known. Only then you can isolate a normal EMG and an abnormal EMG. So based on this, the raw what is pre-processing, we need to use a Butterworth filter, Butterworth band pass filter of range of pass band range 100 to 500 micros, because most of the EMG signals will lie only within this range. And it is very essential to remove the hum line interference 50 Hz, because we are using electrical impulses. So it is very essential to remove that hum line interference of 50 Hz. So what are the methods of extracting the features? There are many methods. Let us discuss the two methods which are used for extracting features from an EMG, to which paves way for disease classification as normal and abnormal by a computer-based system. So there are what we call as time domain features. Time domain features are those features which you obtain directly from an EEG wave without subjecting the signal to any kind of signal transform. You don't apply Fourier transform, you don't apply Fourier transform, you don't apply any form of signal transformation. Directly you can extract those features. What are those features? What does we extract those features in the time domain? So without converting into frequency domain, it's not without applying a Fourier transform or Fourier transform. We don't convert the signal into another form. You take the information in its available form. What are those features? What are the common time domain features that are available? The first one is mean absolute value. So mean absolute value is that you select a window. For example, if there is a EMG wave, you select a window, a fixed window for a duration, for some time duration. You select a window for some duration. In that window, you calculate what is the average value of the signal. What is the average value? That is mean absolute value. Similarly, what does next? You can take standard deviation. It represents difference between each sample of the EMG with its mean value. And next you compute the variance, and you compute the zero crossing point. For example, if this is the baseline and you have an EMG and these points are zero crossing points, and where the wave changes from positive axis to negative axis, these are zero crossing points. So in that window you count the number of the time the sign of amplitude changes. For example, if you take this amplitude axis, this is the positive axis, this is the negative axis, this is the baseline. So you have to know how many times the signal has crossed the baseline. That is what is the zero crossing point. And number of peaks. The number of peaks is the number of values that are higher than their RMS value. This is an AC pattern, so we bother about the RMS value. So number of peaks, peaks is the number of values that are higher than their RMS value. See, these are time domain features. We extract these features. These features will differ, will not be the same for a normal and abnormal EMG. A normal EMG will have a set of values which will significantly differ for an abnormal EMG. Similarly, for frequency domain. In frequency domain features, what we do is that we don't take the signal in that domain. You convert the obtained signal into frequency domain by applying Fourier transform, and from that frequency obtained frequency transformed signal, you compute all these features. These features, wavelength, length, mean frequency, median frequency, mean of peaks, standard deviation of peaks, these values will definitely be different for a normal EMG and an abnormal EMG. And these extracted features or these features are used to train a system to classify and give an EMG whether it is normal or abnormal. So this is how the system functions. What you do is that you take a raw EMG, process it, you extract the features, either go for time domain features or frequency domain features. You extract both time domain and frequency domain features. You give all the features to a computer-based system. The computer-based system should be trained with the features of a normal EMG and for a subjects with abnormal EMG. So once a system is trained with normal and abnormal values, and it can effectively classify a given EMG as normal and abnormal. Thank you.